All right. Hello, everyone. Welcome to our latest webinar in our wellness webinar series. We are delighted to have you join us today for our topic, My Teen Has Depression, How Can I Help as a Parent and Caregiver, presented by Dr. Nicholas F. Navarez Linares. So this webinar will help parents and professionals as well, whoever is in the audience joining us, understand and support teens experiencing depression with or without suicidal ideation. Today, you'll learn to recognize the signs and symptoms of teen depression, differentiate it from typical adolescent behavior, and discover strategies for effective support. So my name is Mackenzie, and I am the coordinator of programs and partnerships with Strong Minds, Strong Kids Psychology Canada. And I'd like to walk you through a few housekeeping items before we move into the formal webinar and I introduce our lovely speaker today. So first, this webinar will be recorded. The recording is in progress, and we will distribute the recording to all participants after the presentation, and it will also be posted and available on our website. Second, the webinar will be about 60 minutes in length, and this will include a Q&A portion at the end. So we will be fielding questions throughout the session, so please go ahead and ask your questions throughout. In order to ask your questions, please do so by clicking on the Q&A button at the bottom of your screen, and that's where you can type in your question. That's where we'll be looking rather than referring to the chat. So before I turn it over, I would like to acknowledge that our head office is located on sacred land that has been site of human activity for over 15,000 years. This land is the traditional territory of the Anishinaabe, the Mississaugas of New Credit, the Haudenosaunee, the Chippewa, the Wendat, and is now home to many diverse peoples. We acknowledge that the City of Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. We acknowledge these nations and any other recorded or unrecorded First Peoples who cared for the land as the past, present, and future caretakers of this land named Toronto, where the trees meet the water or the gathering place. As settlers, we entered into an agreement to share this land equitably, and as settlers, this recognition of the contributions and historic importance of Indigenous peoples must also be clearly and overtly connected to our collective commitment to make the promise and challenge of truth and reconciliation real in our communities. We are grateful for the opportunity to work with communities and on this territory. So for those of you who are tuning in who may be new to our organization, welcome. Strong Minds, Strong Kids Psychology Canada is a registered charity. We are dedicated to nurturing resilience in children and youth through the use of psychological science. We offer webinars, we offer various programming, and our wellness webinar series provides valuable insights and information to child-serving professionals and parents as well, who work and live with babies, children, and teens. So just to share a little bit more about our organization and what we do, I'm going to play this short video.
They tell us to be strong, to stand up for what we believe is right, to chase our dreams, to be exactly who we want to be, without settling for less, without fear, without that voice in the back of our heads saying we're not good enough. They tell us to be strong-minded, but they don't tell us how to build a strong mind. Thankfully for us, Strong Minds, Strong Kids is there to help. They offer psychology-based, evidence-informed programs, tools, and resources that could help me develop the mental strength I need to face all the ups and downs in life, because they believe that we're the future. They believe that the tallest towers have the strongest foundations.
So this year is particularly exciting for us. It is our 50th anniversary. So for 50 years, we've been dedicated to using psychological science to equip Canadians, particularly our children and youth, with the tools they need to manage the many adversities in life. So to help us kick off this milestone, we are hosting our Growing Minds Conference, which will include a jam-packed day of informative sessions by expert psychologists and child-serving professionals on a variety of topics related to children and youth mental health and mental well-being. In addition, we're also hosting our Growth Gala, which will include a fantastic night of food, presentations, and raffles, all going towards supporting the goal of impacting 500,000 children and youth this year. So both events will be hosted at the Marriott Eaton Centre in Toronto on November 14th, 2024. And if you're interested in joining us for either event or both, you can scan the QR codes there on the screen, or you can head to strongmindstrongkids.org. So now I'd like to introduce you to our speaker for today's webinar. Dr. Navarez-Linares is a licensed psychologist with the College of Psychologists of Ontario and L'Ordre des Psychologistes du Québec. He specializes in providing comprehensive services to children, youth, and families with neurodevelopmental disorders, medical conditions, and gifted and twice exceptional profiles. In therapy, Dr. Linares offers support in English, French, and Spanish to children and youth up to 19 years old who are struggling with anxiety and mood disorders. He assists with various challenges, including managing suicidality, stress, interpersonal relationships, toxic masculinity, and executive functioning. Additionally, he provides specialized support to gifted, twice exceptional individuals and LGBTQIA2+ youth. Beyond his clinical practice, Dr. Linares serves as part-time professor, supervisor, and actively participates in various local and national committees dedicated to promoting psychology training and awareness. So welcome, Dr. Linares. I'm so excited for this presentation, and I will stop screen sharing and turn it over to you. Oh, you're just muted.
Unmute. All right. So we can get started. Everyone can see. Thank you so much, Mackenzie, again for the introduction. Give me a second. I don't know what's. Oh, I was at the end of the presentation. That's why. Voila. All right. So we already completed the line acknowledgement, but in my case, I just want to take the time to say that I work in this presentation is given from the Ottawa-Gatineau region, which is in the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. Throughout the presentation, I'm going to be presenting information that might trigger your own emotional responses as a parent, caregivers, or even some professionals. So at some point, don't hesitate to leave the presentation or engage in self-coping mechanisms, as these topics can be quite sensitive, especially when it touches a personal chord at home. Don't hesitate to take the time to step out if you need to. As Mackenzie said, don't hesitate to write your questions throughout the presentations, but we will also be saving some time at the end to discuss some of the questions that you might have throughout the presentations or questions that you already had before coming in today. So as a housekeeping parts of the presentations, we're first going to talk about signs and symptoms of depression. Then we're going to switch to how to initiate this conversation and how to listen, because it seems that to be simple, but it's not that simple. What are the strategies that you can use to support your team? And as a last piece is how to address and how to support your youth who's experienced suicidality. So before getting started, a little bit of information about depression to make sure that we all understand what depression is. There's a difference between depression, feeling depressed, so that's a feeling and emotion, and having a major depressive episode, which is a clinical diagnosis. And we're going to get into that in the next slide. But just to give you a little bit of statistical information, in Canada, almost 40% of people experiencing depression will have experienced that first episode before entering adulthood. And when we look at statistics worldwide, depression is a common experience that humans have. So what I'm saying to you is that if your youth is experiencing depression, there's nothing wrong with them. It's a common human experience. In terms of depression in adolescence, when an adolescent is experiencing a major depressive episode, often, in about 60% of the cases, they also have another mental health presentation or diagnosis. So that can be, for example, an anxiety disorder, ADHD, substance use, eating disorder. They can be other mental health difficulties. It's hard to say if it's the depression who was caused by those mental health difficulties that your youth was already experiencing, or it can be a combination of both. In terms of the prevalence of depression, as you know, we all have experienced this pandemic throughout 3 years. What we know in terms of statistic, as research is now being published more and more, and we're able to also do what we call meta-analyses. So look at overall a lot of research that has been published so far. What we understand now is that before the pandemic, the rates of depressions were significantly lower compared to what they are now. So what I'm saying to you as a parent is that it's important for you to understand that we still don't know what are the effects of the pandemic on your youth mental health, especially for those who are entering puberty or are about 13, 14. We still don't know how much the pandemic have exacerbated or caused some of the mental health that your youth will experience. For example, a recent meta-analysis found that about 1 out of 4 youth during the pandemic could have met the criteria of a major depressive episode. 1 out of 4. That's a lot of youth feeling like they're depressed. So it's important for us as parents, as professionals, to be aware that, as I said, depression is a human experience. And due to the pandemic, we now know that it's not unusual that teenagers, adolescents are experiencing more mood and or anxiety disorders. It's now becoming more a common presentations that mental health practitioners, but also other healthcare practitioners are observing, is that they tend to have higher levels of anxiety, stress, lower mood. So the pandemic has had a toll on these individuals, these teenagers, not only us as adults. As for a major depressive episode, as I mentioned to you, it's important to distinguish that piece of feeling depressed. So we all have bad days. You have bad days, I have bad days. We're gonna feel low. We're not gonna be as joyful as we are usually. It is normal. That's a normal human experience. When we talk about major depressive disorder, that's the clinical diagnosis, meaning that for about 2 weeks, most of the days, the person, the teenager, has been experiencing a lot of difficulties emotionally and behaviorally that are impacting their overall functioning. And that's the key word about a major depressive disorder, is that when it impacts their overall functioning across different environments, not only at home, not only at school, not only with their friends, but across all their environments that your youth is. So one way for you as a parent to kind of monitor a little bit of if you're thinking, I'm not sure if my child is depressed. So there's a fantastic mnemonic that you can use. S is for sleep. So if you notice that your youth is either oversleeping or is not sleeping enough. I for interest. If you notice that, for example, your youth doesn't have the same level of pleasure as they used to do in completing or doing their activities, or actually it has significantly reduced. Guilt is that often unrealistic. That's for J. And that example for that you can notice is, for example, your youth asks you to drive them to a friend's house, but you couldn't. They're gonna feel guilt about asking you. As an adult, we might be thinking, but that you shouldn't feel guilty about it. But that's one of the core symptoms of depression, is that level of guilt that is often unrealistic. It makes absolutely no sense. Now we have E for energy, mental and physical. So that can be that your youth might be more fatigued from a mental perspective, or be more physically fatigued. So that you might see that they're not going on walks, they don't want to walk the dog, but they used to do it, or they're not physically active as they used to be. C is for concentration, meaning that they're going to look like ADHD-like behaviors. So I'm not saying that your youth has ADHD, but what I mean by ADHD-like behaviors is, for example, they're easily lost in their own thoughts. They're unable to remain concentrated. It's harder for them to sustain their attention. You could tell them to clean their room, and a second later, they already forgot what you told them. That's the piece of concentration. It is also impacted. And what we know in terms from a neuropsychological perspective, it's very clear that people who are depressed, so a major depressive disorder, we know that their overall cognitive functioning, it is impacted. So when we do testing with these youth and adolescents, when we write the reports, we always put a caution in the report because we have an underrepresentation of their actual potential, because overall, their cognitive functions is impacted. Now we have A for appetite. That means if your youth is either overeating or not eating enough. So that means that their weight might also fluctuate due to changes in appetite. For P, we're talking about psychomotor, and that means either retardation or agitation, meaning either your youth is slow, it's not doing that much as they do before, they're spending a lot of time in the room, or everything takes so much time, or agitation means that it's almost like what parents often use these words like manic behaviors. So they're already on the go. Almost if we're talking about more that ADHD-like presentation, more from the hyperactive or impulsive type. And then S for suicide, meaning having thoughts, plans, or behavior. So if your youth, you're noticing these changes in them, it doesn't mean they're depressed. They just might be a common normal experience as a teenager. So sometimes parents will use online questionnaires. As a professional, I always tell parents, use them. It's a great tool for you to know what might be happening with your youth. But it's important for you to be mindful that it's a questionnaire. And that's why we're here as professionals, is to determine if what your youth is experiencing is within normal limits. It's what we would expect for their developmental age, or we actually have to start being concerned and they might require services for that. So in terms of emotional changes, so as I was just saying, as professionals, we will determine what's normal and what's not, because having ups and downs are just part of being a teenager. And there's a difference between having ups and downs and having depression. If you think about you being a teenager, there are days that we want to spend a lot of time with our parents, with our friends, and there are other days that we didn't want to. It doesn't mean that we're depressed. It just might be a typical teenager experience. So in terms of emotional changes that you can observe in your youth is a level of increased frustration and anger, even over minor issues, like they drop their fork or they break a glass and they get triggered from 0 to 100, and you're just sitting there and thinking, oh my God, like it's not a big deal. For them, it is. They can also experience higher levels of irritability or annoyance. Everything is just annoying. You asking questions, trying to care, or you even try to talk to them and they give you these looks or they call you out. Those are the things that they can experience. Feelings of worthlessness, excessive guilt, low self-esteem. They also might experience what we call hypersensitivity to rejection or failure. So we know that as part of being a teenager, failure is the way that you learn. Unfortunately, for teenagers who are, or just individuals in general who are depressed, rejection is significantly higher. And it can just put them in a vicious cycle of not telling themselves, I'm not good enough, low self-esteem, feelings of worthlessness, excessive guilt. So that's what can happen by these feelings of failure. They also might not be able to ground themselves in the future or have a negative look on life. So why should I be living? Why is it worth that I go to school? Why is it worth that I continue putting all these effort? It's a normal experience that it's part of being depressed. What I always say, sorry, to parents who I see in my office, when whenever their child is depressed, or a clinical depression, is that from a neurobiological perspective, there are brain changes. And what I mean by that is the different neurotransmitters, so the way that the brain is communicating between the different regions, or even within itself, or even some parts of the brain are changing due to the depression. So when we think about that, it sometimes as a parent, it's important for you to be mindful of that it's not your youth problem. It's really how their brain is changing due to the depression. And what we know now, due to the advances in technology for imaging studies, is that we also are looking at brains who are different before and post depression. So it's normal for your youth to struggle. Depression is not just a feeling of like, I don't want to do anything. There's a big neurobiological component to feeling depressed due to these changes that are happening in the brain. So in terms of behavioral changes that you might also observe in your youth, we can have, as I was saying, that neurobiological perspective, but also from a neuropsychological perspective, is being slow in thinking, speaking, body movement. It can take them so much more time to complete their work or even think for a simple question. They might experience a lot of physical symptoms, such as body aches, headaches, vomiting, not feeling well. It's absolutely normal. They can also, even though they are, maybe your youth is extremely social and they like to be with others, they can go from one day to another, from withdrawing from that slowly to the point that they're not connecting with their peers anymore, and they're actually isolating themselves. Same thing at home. You might have a youth who you have a great relationship with them, but when the depression kicks in, then you start seeing them being more and more alone and isolating themselves. So what I'm saying to you as a parent is that these behaviors are absolutely normal when you're going through a depression. It's okay that you are worried about your youth, but in these cases, it's not something that is unusual for them. It's a common experience that people can have when they're experiencing a major depressive episodes. And the last is engaging in what we call self-harm behaviors, like cutting, burning, trying to kill themselves. Not everyone who's depressed will experience suicidality, but it's a common presentation that we see, and I will get back on that when we get to that section of the presentation. So how to initiate the conversation? This is the most difficult piece that parents struggle, and it's okay because we are not trained as parents. We don't come with a book that says like, this is what you should do when your teenager is depressed, anxious, is being bullied, has their first breakup. It's okay for you to seek out for help to professionals so you can be better equipped to engage in these conversations with your child. So in terms of initiating the conversation, I would say that choose a room, a place in your home where your teen feels comfortable and relaxed. In those moments, this is not the time to talk about them not doing the dishes or not participating on chores. These are the times for you to talk about their depression when things are going not well for them. So it's not time to bring up past problems. This is about them. This is not about the problems that they have experienced. As a parent, it is hard, but you have to listen. Sometimes in my office, and that's a common experience that I heard from different colleagues, sometimes we would just listen to youth for almost an hour, and they will tell us like, this felt so great, like, I was able to talk to you and now things are making more sense. But in reality, I just sat there for about an hour. I maybe talked for 5 minutes, and the only thing that their youth needed is to talk. It's the same thing for you as a parent. Maybe your youth will share that they engage in sexual behaviors. Maybe your youth will share that they started smoking, drinking, using drugs. It's okay that it's going to create an emotional reaction for you. But in those moments are crucial because it means that your youth is trusting you, that you're there for them. It's okay to freak out as a parent. And that's when you're going to seek out for help. But that's how we as psychologists or other healthcare practitioners can help you navigating those waters and engaging in more healthy behaviors in your youth. Let them know that you're available to talk whenever they feel. Be patient. The goal for having these conversations with them is being non-confrontational, expressing concerns and care. So it's okay that you tell your youth, hey, Nicholas, I'm feeling very sad about what you're going through. I'm concerned about your mental health. I'm concerned about how things are going. How can I help you? How can I support you? It's a very thin line in terms of sharing your own stresses and anxiety and telling that to your youth, because that what can happen is your youth might not want to talk to you anymore because they don't want to cause you more stress. They don't want you to care for them. That's when I tell parents it's okay for you to have those feelings. You can tell them to me. You can reach out to a friend, to your partner. But in terms of your youth, it's more important that it's about them than about you. Use I statement. I know this sounds very basic, but it's important for you to say like, hey, Nicholas, I'm seeing that you seem down lately. I'm worried about. So I statement will remove that pressure that you are doing this, you are doing that. So maybe the youth is not doing it on purpose, it's unconscious because depression affects overall their functioning. So in I statement, it allows them to see that you're observing things. You're not telling how they should be feeling, how they should be behaving. It's important to be patient, not criticize your youth, and stay calm because they're going to share things to you that you might not want to hear. But again, it's important for you to be present for them. We can talk about later with them if they engage in risky behaviors or they're drinking. But in that moment, what they need is to be heard. It's not to be told that what they did was wrong. So it's okay for you to say, hey, Nicholas, I'm sorry that you are going through depression. I'm sorry that you started drinking. I'm sorry that you started smoking. We can talk about that later. How are you feeling? By shifting about what's happening in the present moment that they want to talk to you, but they know that there will be consequences of their behaviors. So I always tell youth that, you're going to do things that are not appropriate. You have to be mindful there will be consequences to your behaviors, but it's okay for us as parents, as caregivers, as professionals to choose when are those times. If they're talking to you, they're sharing, that's not the time. We can talk about it later. Now, in terms of questions, so these are just general questions that you can ask to your youth if you think that they're going through depression. As psychologists, as healthcare professionals, we're going to screen for more than these questions. So we're going to look at depressed mood, changes in appetite and weight, as I said, insomnia, fatigue, changes in sexual behavior, somatic symptoms, if they have suicide, hallucinations, if there's presence of obsessive compulsive behaviors, or anything that could potentially explain why they're feeling depressed. So as a parent, your job is to remain more general and screen for changes. And that's when you come to the office or you talk to your healthcare professional and you start sharing these concerns that you have that you've noticed in terms of changes. So at the end of the day, what I would say as a parent is to notice if there are changes in patterns of behaviors or emotions that are lasting longer than 2 weeks. If you see that things are getting worse and worse, there's no improvement, that's when you can start being concerned. And that's when you can seek out for a consultation with your family doctor, with their nurse practitioner. You can even talk to your guidance counselor at school and see if they're also noticing the same things. Now, in terms of strategies to support your teenager, there are 4 main pillars that I would say that we can use to help them. Supporting communication, encouraging help, teaching coping skills, and promoting healthy habits. So in the supporting communication sections, it's the basics. And what I mean by that is providing emotional support, create a supportive environment, be patient and persistent. What I mean by that is when someone experiences a depression, it doesn't only affect them, but it actually affects the family. We know that it can happen that if there's a family member who is going through a major depressive disorder, it can happen that some of these family members also develop a depression, because depression, it's not only about one person in the family, it can affect the whole cohesion in the family system. So it's important for you to be patient and persistent. You might think like, well, they just should like shake it up and like move on to the next piece. That's not how depression works. Depression takes time. You just shake it up and move on to the next piece. It can take 1 month, 3 months, 6 months before they start getting better. Everything depends on the child. And it's important for them to feel that you're validating their feelings, and they're able to express it. They might not use the right words. They might over exaggerate, or they might be underreporting what they're feeling. But your job as a parent, it's not to tell them how they should be expressing themselves. Your job as a parent in that moment is to be there for them and feel and have that possibility of your youth to continue sharing information to you so you can continue monitoring how things are. In terms of encouraging professional help, as I said, it's always, I would say, good to at least consult with someone if you're unsure about how the depression is going for your youth. So seek out to a therapist, a counselor, a psychologist, even your family doctor can help you find resources so you can talk to someone. In cases of depression, we don't always start with medication. However, in some cases, it is necessary for your youth to take medication to help them getting out of that depressive disorder. So if your youth is ever prescribed medication, it's important for us to monitor their usage, making sure that they're taking their medication, they attend their regular checkups, but also monitoring for side effects, because there's medication that can cause sleep problems, that can cause sexual dysfunction problems, that in some cases that can even increase the suicidality. So it's important for us to monitor those pieces. Whenever I have a youth in my office, and I'm treating it for depression, and we decide as a family that even after 15 sessions, 20 sessions, things are not working, and we decide that we have to introduce medication, I will monitor that and I will have a conversation with their family doctor or the pediatrician if I see potential side effects that needs to be addressed right away. In terms of promoting healthy habits, research is very clear about depression and healthy habits. And what I mean by that is getting more exercise or getting more active, sleeping better, or having a better sleep hygiene, eating better. But between you and me, it's very hard when your youth is depressed to try to promote healthy habits such as engaging in exercise, eating better, and sleeping better. So it's important for you to set realistic expectations in promoting healthy habits. The goal is not to get them do 30 minutes of exercise outside. Maybe the goal is just to get back in walking the dog or just walk around the block. Sometimes those are the only homeworks that I will give to parents and the youth, is trying to get out of their comfort zone. And then we start adding piece by piece. And in terms of promoting healthy habits and setting realistic expectations, it's also about what you're expecting from them in terms of school, because we know that school is the biggest moment in your youth life, and that's what's taking the most piece. As a school psychologist working in a school board, but also as a psychologist working in the private sector, it has happened that I've had these conversations with families in their schools where, you know what, your youth is, their level of depression is so high and severe that having 4 classes, it's not the right thing for them. So I have had patients who we had to reduce their course load to 3 courses, to 2 courses, and that's okay. As parents, you are, of course, are worried, you're freaking out because that will maybe delay their graduation. But I always tell parents, it's better to have in taking this moment to ensure that your youth will feel better and we're addressing the depression, then in 10 years, your youth might have another depression because we didn't properly address the problem. So if your youth is a high achiever or you're a high achiever family, this is not the time to request 90s, 80s. There's times where just passing the class, it's good enough, and that's what we want. So it's important to set those realistic expectations. When your youth is out of their depression, absolutely, we can go back to the expectations that you had or that they want. But before that, we have to ensure that it's about them and ensuring that they will be in a better mental health and psychological well-being place when they're out of their depression. And coping skills and engagement. So as much as possible, trying to tell them to reconnect with their friends, celebrating achievements. So I know it sounds easy, but hey, they cleaned their room. Thank you, Nicholas, for cleaning your room. I know it's been very hard for you to have your room clean, but I really appreciate you took the time. That in your youth who's depressed, who is highly critical, who knows that they're failing at everything, just hearing the parent letting them know that they appreciate them for having cleaned their room will make a change. So it's kind of going back to the basics of promoting and promoting positive behaviors instead of focusing on the more negative ones. Now, if we talk a little bit about suicide. So adolescents who experience a major depressive episode are at a higher risk of suicidal ideation. In terms of studies, we see between 49% to 64%. So we can say that it's almost 1 out of 2 adolescents that can experience suicidal thoughts. So when I say suicidal thoughts, there's a difference between thinking about suicide and having a plan, or being passively suicidal and being actively suicidal. So when we talk about passive suicidality, it means that your youth will have things like, I don't want to live anymore. Like, yeah, if a truck would hit me, I'll be happy. Or if I fell down the stairs and I die, I'll be happy. Those are what we call passive suicidality, meaning that your youth is not seeking out to die, or they don't want to die, but the thought of it doesn't bother them that much. And what we call active suicidality, it means that your youth has a plan, your youth is engaging in self-harm behaviors, and those are the ones that are the most concerning because it means that they can actually act upon it. When we talk about suicide, there's a big myth when we say that we shouldn't talk about it. It's not true. If your youth is suicidal, whatever it's passive or active, you have to talk about it. You have to be direct and ask those questions. So, Nicholas, have you self-harmed in the last week? Nicholas, have you been thinking about killing yourself? It's important that you choose your words carefully, you're direct, and also hopeful. And when I tell teenagers, for example, it's like, I know you want to kill yourself. I know that you're not feeling great right now. I know that you think that this is the end for you. But be mindful that this is because you have a pair of glasses that are seeing everything that is negative. But things will get better at some point, and your negative pair of glasses will be changed to something more positive. If your youth is female or male, that's also a piece for you to be mindful. Females have a higher rate of trying to kill themselves, but the way that they do is less severe compared to males. So what I mean by that is males will tend to use more severe behaviors, such as putting a rope around their neck or trying to kill themselves in a more drastic way compared to females. So when I have a youth in my office who's engaging in self-harm or have active suicidality, that's a huge red flag for me, and all the alarms in my head are going, because I know statistically speaking, males are 4 times more likely or 3 times more likely, depending on the research, to engage in more severe behaviors. It doesn't mean that females, there are not alarms going on in my head. They are. I'm going to be there for them. But if you know that you have a male teenager, that's when you can worry more because of the more severe and drastic measures that they can take. So how do we talk and address about suicide? The first piece that I would say is include the school, of course, with your youth permission. Because what we want is to have a connection in the place that they spend the most time. And sometimes parents are very surprised, but their youth can engage in self-harm behaviors or even try to kill themselves at school. So it's important to have, I would say, as of course, I'm biased. I'm a school psychologist. I've been working there for over 4 years in a school setting. So I know how important for me is to know that information so I can be there to support the youth, but also their teachers being aware so they can support your youth if, for example, they're not feeling well. They know that they have to act upon it. So how do we address and talk about suicide? Sometimes parents don't always take it seriously. As a professional, whenever youth is telling me that they want to kill themselves, I have to take that very seriously because you don't know if it can take a negative comment from a peer or something that they perceive as negative, and that can be a trigger. So it's important to always take what's happening seriously. Listen and stay present. Of course, as a parent, it will trigger you. You will have your mama bear, papa bear mode activated, and you will become emotional. As much as possible, remain calm and present for them. You're there. Nothing is going to happen. You're with your youth. So it's important for you to, again, remain not judgmental. Let them speak. Let them just say and vomit whatever they need. Sometimes that can be used as a grounding technique of just letting them speak and write up about whatever they're feeling. And that's okay. Sometimes that's what they need, and that might reduce their levels of suicidality, and they will maybe feel okay after that. Be direct. Ask the questions. Do not hesitate. And what I mean by that is in French, we have what we call the COT, the comment, où, quand, or in English, we can use the wow, the when, how, and where. So if you know that your youth is engaging in self-harm behaviors or have active suicide, if your youth is able to respond to these three questions, the when, the how, and the where, that is a significant red flag. And that's when you need to take measures. And that could be going to the hospital, for example, because that means that your youth, it's a higher risk of actually going through trying to kill themselves. Safety is the priority. What I mean by that is I always tell youth and parents that, yes, all the information is confidential, but at the end of the day, safety is your priority. So if your youth tells you, I don't want you to tell the school, I don't want you to go to the hospital, be mindful that confidentiality doesn't prime safety. That's what's the most important. Also, if you know that your youth is engaging in self-harm behaviors, engage in that conversation with them that you're going to be removing like pointy things at home, sharp objects, firearms, a medication, so they can avoid in these moments when they're dysregulated to use those tools to try and kill themselves. But it's important for you to tell them that and not just act upon it, because by telling them and including them in the decision, they're going to feel more comfortable that they see you as someone who's actually helping them, and they're not making decisions for them, but they're being part of that decisions. Try to distract and using different coping mechanisms that you already know. Of course, when your youth is suicidal, as I said, try to reach out to the school and see if they can help you find professional resources in the community, or if you do have the means, engage in therapy with your youth so they can receive the proper services to decrease those levels of suicide and getting them out of their depression. And we always have to continue looking at the warning signs. So if your youth is suicidal, that primes everything, is safety before confidentiality. And the last piece that you can use is what we call a safety plan. So there are different safety plans that are available online. This is just an example. But what we can do is create a safety plan with your youth with what are the triggers, what are the things that set them off. So that can be like my mom asked me to clean my room. What are the coping strategies that that works for them? That can be, for example, listening to music, or taking a shower, then what are the warning signs that your youth recognizes when they're feeling that way? So that can be when I'm overthinking, or I'm feeling a lot of stress, or I'm reviewing my whole day. And how do they feel about it more on the physical side? Does that mean that I get agitated? I get more irritable from a perspective, like I just feel frustrated all the time? In those body sensations that it can have, or the behaviors that they're going to engage in, such as overeating, eating less. Those can be their warning signs. Then in here, it's the reasons for living. So what are the things that are very important for them, and who do they care of? And I would say that, again, this is one of the red flags that we have as professional, is when a youth has difficulty grounding themselves in the future. That's when we know it's going to be difficult to treat the depression, because there's nothing that is grounding them in the future. So that's when it becomes more important for us to act upon it. So if your youth has, for example, I don't know, their graduation, or they're supposed to see their friends next weekend, and they don't seem to care that much, or they're unable to see things in the future, that's when it becomes more difficult. So having in your safety plan something that can ground them in the future can help them remind that it's worth it. And then what is the support system? Who can be there to support them? And at the end, resources. So what we do, we create a safety plan, and then we not publish it, but we put it across it can be in the home, it can be on the fridge, it can be in the room, it can be in the bathroom, because we never know when your youth is going to start feeling suicidal. So it's better to put them as much as possible in different rooms. So whenever they're feeling that way, there's a reminder. And that means that you have to include all the other family members, because as I said, depression affects everyone in the family. So it's important that every single family member knows that your child is going through a rough time. It's very difficult, and we're going to start doing things a little bit different to support them. So having these safety plans across the home can be a conversation with the whole family, so they're not surprised by this information. So today we talked about different signs and symptoms of depression. We talked about how to initiate the conversation, strategies for supporting, and how to address and support it in terms of suicide. This was a very, I would say, crash course. There's information about it, but what I would say in terms of as a parent, the main message, or the key message that I would have for you, is to be there for your youth. They don't need to have another adult who's telling them that they're failing or they're not doing enough. They need someone who's going to be there to listen and being present for them. So if there's a key message from this presentation, is we have to change the way that we talk to our youth. We have to change our perspective, and we have to remain present and validate their emotions as much as possible. And it's okay for you as parent to also seek out for your own therapy or your own help, because we know that it can cause this distress in parents. So it's also for you as a parent to get that help if you need. So Mackenzie, now we have a little bit of the questions. So I see on the chat for the mnemonics. So I'm just gonna get through them to make sure that, sorry for going a little bit too fast. So for the mnemonics, we have, we have the S is for sleep. So oversleeping, not sleeping enough. I for interest, reduce or loss of pleasure. J for guilt, often unrealistic. E for energy, and that can be from mental or physical fatigue. C for concentration, being distracted, not being able to remember the information, being indecisive. Appetite, decrease or increase appetite, changes in weight. P for psychomotor, meaning retardation or agitation, meaning that they're either over hyperactive impulsive or they're not doing that much. And S for suicide, having either thoughts, plans, or they're engaging in behaviors of suicide. And yes, the slides will be sent to you after the presentation. Does
Awesome.
anyone else?
Thank you so much.
No problem. Go ahead, Mackenzie.
So if anyone has questions, I see we have someone who popped them in the Q&A. Please feel free to do that. Thank you so much for that incredibly informative and insightful presentation and sharing so many practical strategies. That was wonderful. So the first question for you is, what can you do for your teen if there is shared parenting and the other parent doesn't want to see and admit to what is going on?
Yes, and those are the most challenging difficulties. I would say that it's important as when you're working with a professional, if you have that possibility, or as a parent, is to first have that discussion between the parents and the professional, and then to include the team. But from a parental perspective, it's highly, highly important that everyone is on the same terms. Because if you as parent number one is providing all this amazing support, but parent two is not, then you can lose all these strategies and all the help that you've been providing, and it can be maintaining a vicious cycle. So sometimes this is when having a more difficult conversation between parents and the professional can happen. And I've had to have those conversations where I needed to point it out to a parent who, because of their own history, they weren't necessarily seeing it, but I was literally had to tell them, your youth is trying to kill themselves. This is not something that we can just brush it off or it would go by itself. Your youth in so much distress. We need to act if we want to avoid in the future having more depressive episodes, because that's something that I didn't necessarily share, is that if we don't treat depression properly, we know that there's a higher chance that you will experience another depression. And the more you experience depression, it can become something more regular for some individuals. I don't want to alarm you right now because there's no need to alarm. That's more when they're adults and things are not properly addressed. So it's important as parents and professionals to have that peace in mind, that it's important to address the present moment, the depression, rather than just thinking about the future, the graduation, or not seeing the problem. Thank you for that question.
So I have another one in the Q&A
Yeah,
for you. So do you think awareness programs such as Safe Talk/Assist are important for parents/caregivers/child supports should engage with?
great question. I would say that in terms of safe talk, of course, it can be a good thing for you as a parent to have under your belt. But at the same time, I'm thinking about you when I'm answering the question, is that you're going to become emotionally involved. Doing what we call suicidal risk assessments is emotionally draining. After these meetings, like professionals, we are exhausted. So imagine you as a parent doing like some sort of suicidal risk assessment or using those tools and then dealing with your youth throughout the whole day, throughout the whole week, the month. You can become yourself depressed or be emotionally exhausted and not being able to be present for your youth anymore because you're not taking care of your feelings. So it's not a straight answer like we love to say in psychology. It depends. If you have a strong level of resilience, you are able to deal with the situation, but especially you feel that you can do it, it's not a bad thing. If it's the first time that your youth experiencing depression and suicidality, or if your youth is experiencing chronic depression or suicidality, then I would say yes, it can make sense to have these type of programs, but I wouldn't necessarily suggest that to parents because I also have to make sure that their emotionally well-being is intact as much as possible.
Just a follow-up question. Someone asked, can you suggest any training programs that might be beneficial?
So there are different like parental groups, trainings that can be offered for parents. Sometimes depending on the youth or the child's age, sometimes it's better for us as psychologists or therapists to work with parents rather than working with the youth directly. So what I mean by that, for example, it does happen that the youth doesn't want to talk to a professional, completely refusal. We have to respect that to a certain level of point. Again, safety first. So sometimes it does happen that I have in my office parents who I'm coaching them from a parental perspective, so parental coaching, So they're able to go back to their youth and use those tools. So there might not be a specific programs that are coming out of my mind right now, but one of the things that I can think is engaging in psychotherapy for parental coaching with a professional, and that's how you can bring that back home.
Awesome. And we'll take our last question here. In your opinion, what role does genetics have in depression? Are there ways to be proactive if my child is predisposed to experiencing depression?
That's a great question. In terms of the more the medical component, that genetic component, we know that it can run in the family in the sense that if you have parents who have experienced depression, their offsprings can experience also depression, but it's not a causality, is what we call a correlation, is they're more likelihood. However, as parents, it's also important to be mindful of specific things, such as normal experiences. You lost a parent yourself. Women, females who experience postpartum depression. It's almost 40% of women, females who experience postpartum depression. Again, a normal experience among females and women. So it doesn't mean that because you had a depression, that your youth will necessarily experience one. But if you know that's something you've been struggling your whole life from a genetic component, and it's been years and years, yes, your child might be more, there's a highly likelihood that might experience depression, but again, as psychology would like to say, it depends, because it can be from a medical genetic component, or it's because of the type of behaviors and emotions that your child is observing, and that could be the reason why your child might experience depression, or again, it can be a combination of both. So like most of mental health disorder, there is a genetic component, but it's not always the case.
Fantastic. And just one quick question, because we're getting close to the end of time. Can you recommend any workshops or training around harm reduction, mental health, and or addiction / substance use?
Yeah, they're KMH, so the Center for Addictions, have amazing tools in French and English for parents in terms of how to engage in these behaviors and how to get more information. There's also, for example, Sick Kids, who offer workshops to professionals, but also parents about self-harm. So I would say KMH would be your first stop. To get more information or seeing if they're offering any trainings, information about how to have these discussions. But also if you look over your school's website, so if you look at your teenager's school website, they often have that kind of information in the resource section. Or if you want something that is more local, often guidance counselors, they will connect with their social workers or their psychologists, who can provide that information to them and share that with you. So again, don't hesitate to reach out. Depression is a big myth still. I know we've made a lot of commitment and changes about mental health, but feeling depressed is still taboo. So don't hesitate to reach out for help. You're not alone. You don't have to go through this alone. There's people who are trained and are more than happy to support you in this difficult period that you're living with your youth.
And I would just also like to highlight that Strong Minds, Strong Kids has a variety of programs designed to support the young people in your life. So I'll highlight our evidence-based stress lessons program, which is designed to support youth grades 7 to 12. So it's tailored for educators, youth serving professionals, and even parents as well. And it's really designed to help you create teachable moments to help young people thrive in a stressed out world. So this program offers a comprehensive guide of lessons, tools, and resources to really empower youth to discover and implement effective stress management strategies, effective coping skills, and really there to nurture their emotional resilience. So if you want to learn more, you can scan the QR code there on the screen. The slides will also be sent to you after, so no worries if you don't have your phone handy. You'll have all of this. And you can also go to our website at strongmindstrongkids.org. We also have our new chatbot for teens, which is available on our website 24/7. So it is adapted from our stress lessons program, and it's really designed for teens to go to directly and ask questions to help support them with stress management. And it includes fun interactive quizzes, videos, activities. It's not designed as a therapeutic tool, rather it's designed as a resource to help them really foster and build effective coping strategies and ways that they can effectively manage their stress. So in order for us to continue providing these free webinars, we would appreciate it if you could just take a few minutes to fill out a quick survey. I'm going to just pop it in the chat. It's also going to be emailed to everyone at the end of the session as well. But your feedback really helps us to understand how beneficial these webinars for you, and also what topics you would be interested in hearing for our next wellness webinar. So as I said, we have a variety of free resources on our website. You can also get in touch with us directly if you have any questions about our programs. I'll also pop my contact information in the chat, and then you can also follow us on social media to stay updated on all of the fantastic things that we're doing. So just before wrapping up, I would like to give a huge thank you to Dr. Nicholas Narvaez-Linares for your time, your fantastic presentation, and really all the incredible work that you do to support our children and youth and create, a better tomorrow for the next generation. So thank you so much for volunteering your time and sharing, all this fantastic information with everyone.
Thank you, Mackenzie. It was a great pleasure, and thank you so much for everyone who attended today. I know it's not easy, these types of topics, but be mindful that you're not alone, and it's difficult parenting a child who's going through depression. But remember that piece, you don't have to be alone.
Awesome. Thank you, everyone. Thank you so much for tuning in, and have a great rest of your day.